Hey everyone, and welcome to the next episode of Guards Down. I have with me today a very special guest, Kimberly Caldwell. Kimberly, how are you?
I'm doing well. Thank you for having me.
Good, good, good. Well, look, tell us about yourself.
Okay. I am currently a licensed clinical mental health counselor associate in Fayetteville, North Carolina. I'm also a psychometrist at the VA. So I do psychological testing for veterans who have dementia or other TBIs or cognitive difficulties. Um, so I, and then I do private practice in the evenings. So I do individual therapy uh, with individuals and couples.
Got you. So you are well immersed into mental health and assessments.
Yes, yes, it is. Actually, it takes up most of my free time and my professional time, but
I,
it's okay. I enjoy it.
well, I appreciate you coming on. When we first spoke, I was like, man, she knows her shit. Like, we're going to have a good conversation.
I mean, here's the thing about that. There is so much information out there, and a lot of information that we have not been privy to culturally, that you can kind of just get immersed in going through all of the material and then applying it, to your professional life and your personal life and saying, oh, okay, well, that's why I do this. Or that's what was going on with my mom and dad. So it can kind of heal you as well as educate you.
Indeed. And so, of course, the show is all about how different cultures view, treat, and overcome trauma and grief. And I personally believe that your trauma and grief that you go through shapes who you become, how you endure what you go through, and how you position. And so, I just wanted to start off and talk about the beginning stages of life and learning. Because I
Yeah.
always ask, my guests when they come on, did your parents or the people around you teach you how to deal with trauma and grief?
Yeah. So coming from a Southern Black Baptist background, um, grief was, you were taught to hand that over to Jesus and to pray on it and to open your Bible. And that's how you handled your grief in dealing with loss or dealing with trials and tribulations. Um, as I've gotten older and worked with a lot of different clients, I've been able to see that awful approach. It's actually an approach that handing things over to Jesus is an approach that actually can teach you to reduce your own anxiety. Because all you're doing is actually after a therapeutic model of letting go and being present. So that actually has helped us culturally to manage our anxiety, Southern Black Baptists in the Black community. However, it also has its pitfalls because when I was growing up, we were not exposed to therapy. Therapy was not something that was talked about. It was not something that was offered. It's not something that was engaged in. And there was a stigma that something was really fundamentally wrong with you if you had to go to therapy. So, and growing up in our environment, therapy was not necessarily spoken of, and it was almost even feared. I remember older family members, even my parents being fearful of getting um, my brother assessed for ADHD because they feared that it would go on his record and he would be labeled. And this was kind of a, it was kind of a misunderstood uh, stigma that they had accepted. So therapy was not anything that was discussed in our household. Um, Grief was addressed biblically, and trauma in my youth, there was not significant trauma that we experienced, or I experienced personally. Um, so I can't necessarily speak to the trauma part of a child, but as far as grief goes, we were um, we were told to refer to the Bible, go to church.
And so it's two parts to that that I want to talk about. The first one is this religious aspect of
Yeah.
how to handle and deal with your grief. And so knowing slavery, knowing that religion was the only thing that our history was
Mm-hmm.
to learn to read and to practice. Um, and then there's this whole myth that trauma is in our DNA and gets passed down. And so,
Yeah.
can you speak to that?
So generational trauma or inherited trauma um, is something that's being talked about a little bit more often. Um, Now, historically and culturally, this has been talked about in our communities frequently, because I remember being pregnant with my daughter and my mother saying to me to be careful of my mood while I was pregnant and being agitated because that would be passed to my child. My child would become anxious. So in so many words, that's what she was saying. So that spoke to the fact that we were knowledgeable that we can influence our children in utero while they're in the womb. We know that our actions, our stress levels, how we interact, and our mental wellness impacts the child that we're carrying. So then comes the larger conversation of trauma being passed down through your DNA or generational trauma. What I think about when I think about generational trauma is I think about the stress responses that we develop. And stress responses come after you perceive a threat or you're fearful. So from the time that we're small children, we can pick up on our parents or people around us being fearful, being scared, or acting in very protective way with, or even being stressed. And we are so in tune with them that we pick up on, that we study that. We get that energy that when they hold us closely, when we're in public, when they tell us don't talk while we're in this office and they have a fearful look on their face. We start to develop stress responses to certain situations, and it is inherited. So that's kind of like a cultural influenced kind of generational trauma that's handed down. We learn to be fearful. We learn to be careful. We learn that there are threats. We learn that we're not safe.
Yeah.
Yeah.
With that, and when you talk about stress responses to fear or, unsure environments, it makes me think about racism and
Mm-hmm.
how there are two sides to a coin. So for um, a minority, a Black person growing up through slavery and then through Jim Crow and then, on into, the civil rights era and that whole nine. And even,
Right.
um, we've always been taught, these stories have been passed on about what's happened to us.
Yeah.
And so, living in that fear, or at least having the knowledge of the fear that's out there, and then seeing it kind of confirms,
Absolutely.
versus our Caucasian counterparts who never had those fearful stories told to them. And a lot of people tend to say that, they live in a bubble because, they didn't have that, right? They
Yeah.
had a better life. And so,
Yeah.
a lot of talk where people are like, how can you say there's racism in America, or, or that all these bad things happen when America's so good?
Yeah. America has been great to some people. When you said we have examples proven to us when we're younger, it puts me, takes me back to my childhood where I had my grandfather's brother. And I specifically remember being very young and asking why the side of his face was burned, scarred. And my dad telling me the story of him working as a sharecropper when he was a little boy. And my great uncle working as a sharecropper and stealing food off of the stove, and the white sharecropper pressing his face down on the burner and burned his face, and to punish him for stealing food out the kitchen. So those are the things, the experiences that confirm this world is not safe for me. I had better listen. I had better be on alert, because these things have happened to people very close to me, and they still carry the scars. To this day, he's still alive.
Yeah. And so I want to touch on that in a second, but I want to go to another point that you brought out when we were talking about, being labeled and misunderstood with mental health.
Yeah.
You spoke about your younger sibling having autism.
No, so my brother,
Your
and
brother.
this is my older brother, could not concentrate in school, was always getting into something. I mean, from a young age, he was hyperactive. He couldn't concentrate. He did well with video games. But his attention to detail was awful. So he had all of these symptoms. Now at 40 or 39 years old, I can look back and be like, oh God, that was so ADHD. He was so ADHD. But back then, I remember my mom wanting to go and get him tested and my dad being against it. And those worries, actually, my dad articulating those worries that he would be labeled. So he went the majority of his elementary, middle school, and most of high school without getting any treatment. And my mother ended up taking him, and he was diagnosed with ADHD, and I think he was put on Ritalin. And she noticed an immediate improvement in his schoolwork, and his ability to focus, a calmness in his mood.
Yeah.
So the late diagnosis and treatment probably, affected his ability to do well in school in those previous years. And maybe even a dose of therapy, maybe even seeing somebody on a regular basis to handle emotions and regulate his mood would have been helpful. But I mean, we can always, hindsight is 2020, and I think they did the best that they could with what they knew. But now moving forward, I think that we have to become more knowledgeable about the mental health care system and what interventions are available for our children early.
Indeed. And I'm glad you brought that up, because when we were talking earlier, I wanted to talk about or hit on the cultural implications for diagnosing. So the actual
Right.
clinician that's diagnosing you, and then you touched the point beforehand talking about a person or a child being diagnosed in the school versus going to an actual clinic and getting diagnosed.
Yeah, yeah. So the cultural, I mean, there have been countless studies that prove that if you have a bias, like providers who are biased, who are not culturally competent, will in fact misdiagnose patients, patients who are of color, due to their bias and due to their um, lack of diversity in their program or in their setting, both personally and professionally. So that looks like a a young Black female high school student who is not performing well, who is angry and fighting all the time in school, getting a diagnosis of a conduct disorder, which is basically kind of like an antisocial disorder. Um, Rather than looking a little bit deeper into that and saying and assessing for any sort of abuse, assessing for neglect, assessing for trauma, past trauma. And then really being able to read the signs. They may say, no, nothing's wrong with me, nothing happened. But if you're not able to really converse with that person or be receptive or understanding of their energy and their movements and their body language, then you may not probe deeper. You may not take your time and try to get to the core of the issues. You may just slap on a diagnosis of she's defiant, oppositional defiant. So this happens frequently. In medicine, and psychology, where our symptoms are not, when we self-report our symptoms, we're not believed, we're not understood. Sometimes there is language used that we're not familiar with. So we might not endorse those symptoms because we don't understand the terminology being used. So I might say, okay, well, Mr., a 60-year-old, 70-year-old Black man, I might say, we think you might have PTSD. And I ain't got no PTSD. I don't have that. I don't have that. But if I were to use the terminology and explain what PTSD and say something like shell shock, and he might be like, oh, like the folks coming back from war. And he might have a better understanding of what it is that I'm talking about. But studies have also shown that a lot of times when we go into Black and brown people, when we go into people of color, into medical professionals' offices, we are less likely to ask for clarification and to have questions about the diagnosis or the medications. So this hurts us as well when it comes to being properly diagnosed and treated.
So, with that being said, sometimes I feel like there's a promotion that they want us to be labeled or diagnosed with these defiant or these types of, behavioral disorders. And it's almost like they will promote it because if you get labeled as that, then you can go on disability and get a check for it, right?
Yeah, so there's some, I used to work in vocational rehab and in with the school unit. So I worked with children, high school age children who were receiving voc rehab services who had been diagnosed with a disability, whether that was a physical disability or a intellectual disability. Um, and they, the diagnosis will and can make it so that you are able to receive more resources. Um, and sometimes, if your disability is severe, you can qualify for disability payments. Um, but usually that comes with some sort of a severe diagnosis of something like intellectual disability, or like a severe intellectual disability, or if your child has a health condition, um, that will qualify them for monetary support.
Mm-hmm.
But the diagnoses, if the diagnosis is wrong or not on point, then that child is not going to be helped by anything. So that's where the importance of making sure that you are going to someone who is reputable to take a look at your child or even take a look at yourself.
So that in-school counselor.
Yeah. So here's the other thing I noticed at vocational rehab. A lot of more affluent parents would get private evaluations. They would get independent evaluations from providers in the community. So they would take their child to go get an assessment at a private practice, psychology practice or psychiatry practice. And then they would take that report and bring it into the school and say, okay, this is what our provider is saying. This is his report. And a lot of times that report and that testing would be very in-depth, and it would be very thorough. There would be a very thorough report. Now, take the school setting. If you're talking about a school psychologist who may have 1,000 children, 500 to 1,000 children who she has to test and give her expert opinion on, I would opt for if your funds allowed for it, I would opt for going to a private practice, someone who could give extensive testing. The testing that the schools can give is going to be very time sensitive. They're going to want to do quick assessments that provide, good information, but in a short amount of time. Private providers may test your child over the course of 2 or 3 days. It's depending on the battery.
Mm-hmm.
So that can lead to, I mean, we look at, counselors and school psychologists who are overworked. They have a huge caseload. Do they really know your child? Do they really have an idea of who that child fundamentally is? And then you kind of have to make decisions from there based on that. But I would not personally, as a mother of a 13-year-old child, I would not be so quick to send her to school to use a school psychiatrist or a school psychologist or counselor, just because they're overburdened, in my opinion.
Okay. So when it comes to assessing, one's trauma or grief, or whatever issues that they're having, uh, look for someone that is culturally competent and look to a facility that is dedicated towards, mental health or treatment.
Absolutely. And who can give you that individual attention, who can really do a thorough assessment. That's what you want to look for, someone who's going to give a thorough assessment of what's going on with your child. Yeah.
All right. And the only reason I'd ask that, and I
Yeah.
want to, skip from what we were talking about to talking about this assessment and the cultural implications, is because I want people to understand that, you have a choice, one, in your provider, and two, you need to know
Yeah.
what to look for.
Absolutely.
And so I want to go back now to our other question, or our other topic, talking about generational trauma and
Yeah.
responses. And so, for a individual, when we're talking about fear,
Mm-hmm.
back then in those days versus now with what we have going on, how can we help someone deal with it?
Deal with the fear that is passed on in our communities.
Yeah.
Okay. It's a very, even now, more so than then, we have social media. We have a lot more access to recording traumatic events. So we are actually taking in images and sounds and experiences over and over again, which can create, it can increase your level of fear and apprehension in certain situations, but it can also desensitize you to the violence. So there's a lot of things happening right now with generational trauma and fear. In order to address it, especially with our young kids, we have to open up the lines of communication. You have to, and we have to limit what and monitor what it is that they're taking in, what it is that they're watching over and over and over again. At a certain point, what is going on in social media becomes trauma porn, for lack of a better term. It's gratuitous. After watching it, you feel worse than you did before you were watching it. It impacts your mood. After watching 7, 8, 9, 10, 11, 12, 15 videos, what does that then do to the person? What fear does it create? What anxieties does it elevate? What does it do? What does it confirm about your existence here? So after we know that our children, especially like our teens, we know that they're taking all this information in, we have to be able to really unpack that with them and make sure that it's not being internalized and that it's not affecting their mood and that they know when to turn it off. Because sometimes you can get locked into a cycle of watching it. And before you know it, you put your phone down or you close your laptop and you feel like crap. And you can't really figure out why you have this feeling, like this heaviness. You've just like completely binged on trauma porn. Multiple people's most stressful experiences in one sitting. And it becomes a lot. And depending on the makeup, we have some children, some highly sensitive. They'll internalize what they're watching and what they're seeing a lot more quickly than others. So you have to know what it is that your teenagers and your children are watching and what are their thoughts, what's their perception of what it is that they're watching, and be able to unpack that with them. And make sure that they know their limits. And if they don't, you create limits. Because I mean, even for me as a grown woman, at a certain point, I turn off you know, Facebook or Instagram, I start to notice that my mood is shifting. So I get off of it,
Mhm.
because the minute that your mood shifts, it affects your behavior. So in order to keep my mood in a good, stable place, I have to know my limits of what it is that I'm taking in. And we got to teach these young kids that, because they are addicted to social media. Like it's a real live addiction. It's one of those where you can try to delete the app off your phone and say you're done, and then you go back by the end of the night and put it back on because you need that fix. So it's something new that we're going to have to address. We're going to have to build a treatment model around what people are taking in, um, off of, the internet. I'm
Gotcha.
sorry. And did I address the question? I know I kind of go off on go off on a tangent. Did I address the question?
You at least gave me a new phrase, trauma porn.
Absolutely. Yeah. Yeah. Take that. Yeah, you're welcome.
You
You're
did
welcome.
address the question. Open up the lines of communication and watching what you take in.
Yeah, absolutely.
When dealing with this generational trauma, or just knowing that you have high tension or high risk for stress responses alerts around you.
Absolutely. Absolutely. Because, I mean, we all we all have triggers. Um, there are certain things that we can watch or take in that create an uneasy feeling or trigger a memory that makes us not feel so good or feel uncomfortable, feel sad, feel anxious, feel lonely. Um, we all have these triggers, and we have to really become very familiar with what our own triggers are and
Mhm.
how to heal them. Um, and it becomes difficult when you are never present within yourself, when you're not paying attention to your body. You're not paying attention to where you're holding tension in your body. You're not paying attention to your mood shifts. So we have to get this generation, including ourselves, to become more present, more grounded. We have to put down electronic, get fresh air, practice deep breathing, um, work through our unresolved issues, because the internet and television has just distracted us, um, and we're not addressing our core issues. A lot of us aren't.
Okay. Well, let me ask you this: with what you're
Mhm.
saying, how people have to be present in the now, and everybody has triggers. Do you think there's a cultural difference in how people cope?
Yeah, absolutely. Absolutely. I think we cope differently according to the tools that we've been given. So culturally, while we have not necessarily been given the tools of therapeutic intervention, we're just now starting to get exposed and take advantage of therapy. Um, we have the tendency in our communities to be told to suck it up, to get over it, to just keep moving, to persevere. You're strong. Again, pray on it. Um, it's very it's very simplified, the approaches and the strategies that we're offered culturally,
Mhm.
which could lead you to feeling very broken if that doesn't fix it, right? So if my grandma and my mama are telling me that I need to just pray, or I just need to let that go, let that bad relationship go, that's in the past, let it go. And I'm like, okay, let it go, it's in the past, but I'm unable to do that. So then, like, what's wrong with me that I just can't let this go? So we start to it can create a feeling of brokenness, and hopelessness and helplessness, or it can create some maladaptive kind of workarounds. So when we say that we're going to get over the trauma, or we're going to get over the experience, something that has happened to us, we may overcompensate by being angry. I'm over that, but I'm still angry. I still have a fuse. I have a quick trigger. So don't try me. That's unresolved grief and trauma. That's what that response is. There's some hurt under there that has not been addressed,
Mhm.
and it's showing its face through anger.
Yeah. And so this is exactly the part that I was going to ask you next. Just kind of to wrap it and all bring it together.
Yeah.
What are some of the signs that you're dealing with trauma and grief? Feelings, thoughts, actions.
Yeah. So, um, the symptoms appear differently in different people, but they can appear as in isolation. Isolation is a big one, and because we are able to interact with our phones so much, and even now work from home, uh, isolation can become a hidden coping mechanism, because you think that you're just kind of staying away from all the drama or whatever, but you're actually kind of separating yourself from society and dealing with depressive and mood fluctuations, a low mood. Um, Anxiety is huge. Anxiety is fear of the unknown. It's a fear of not being able to control what is about to happen. It's being in a perpetual kind of state um, of distress, unable to move forward, stuckness. Um, Anxiety from trauma is kind of like your stress response being activated all the time.
Mm-hmm.
So in animals, right? So you see animals, and you might see, like, an animal is under attack. So a lion is attacking a gazelle, and during that moment, the gazelle's stress response, their serotonin is heightened, right? And it runs and it gets away, and then it goes back down. Those stress levels go back down because it's out of danger, right? With humans, what happens to us with trauma and anxiety is we are we are in the danger, we get out of the danger, but the serotonin levels never really bottom out. We're perpetually in a state of looking around, being fearful, being hypervigilant, anticipating what's next. So that type of hypervigilance, um, that high stress response is one of the bigger symptoms that you'll see. Someone always being on guard, always being ready for the next attack or wanting to be ready, concerned with being ready.
Yeah.
You know, it's at the front of their mind.
It's it's the same. I remember it. It's talks about, if you're constantly thinking about the past, you're dealing with X, and if you're constantly worried
Yeah.
about the future, you're dealing with anxiety.
So yeah, if you're constantly focused on the past, that's like depression. That's the root of depression. If you're constantly worried about the future, that's anxiety. And a lot of people suffer from both. So
Right.
you want to talk about something completely exhausting, it's that.
Correct. And so let's talk about living in the present and how
Yeah.
to get your mind into that state of doing so.
Right. Huh. So this is in private practice, this is a lot of what I do. Probably 50% of my treatment plans revolve around getting people to be more present, um, having them not be stuck in the past, dealing with ruminating thoughts, playing scenarios over and over and over again in your head until your body is actually responding like you're back in that situation. Um, and a lot of this happens by identifying. So I take a CBT approach. So what I like to do is I like to identify cognitions or thoughts that a person is having that lead to feelings that lead to behavior. So a lot of times we can eliminate anxious feelings and depressive feelings if we can get rid of the thoughts that create them. So if I am thinking about work and a stressful situation at work, and my thoughts are, I might ask a patient, so what are your thoughts around this conflict with your boss? What are your thoughts around? He's going to fire me. He's going to try to retaliate. He doesn't like me. So these thoughts, so I'm like writing down the thoughts, like, okay, he's going to fire me. So then I'll ask them, so now after you have that thought, what's the feeling? And they'll say, oh, the feeling is I'm scared, I'm on alert, I'm very sensitive, I feel targeted, I feel like I'm being bullied, I feel weak. So all of these feelings stem from these thoughts. And then I'll ask you, okay, so after you feel that, what is your behavior like? And they'll say, oh, I'm in my office all day. I overwork. I double check my work. I make sure that I'm on time. So when we get to the end, I bring them back and I say, okay, so all of this started with these thoughts. So if we can work towards changing the thoughts that arrive, that come up when we're in a challenging situation to something more positive and less anxiety producing, we can work towards getting a person not to bottom out and get into those feelings and that behavior that keeps them stuck and keeps them in a bad place. So we replace thoughts. So instead of my boss is out to get me, we say, how about we replace that with, I am doing the best that I can at work and I'll continue to do my best. Like a reassuring thought rather than one that kind of creates panic and fear. So we identify certain thoughts to replace the negative ones so that we don't go down that rabbit hole.
So, with that being said, that rabbit hole, um, one, do you feel like a person has to wait until their darkest hour or until their darkest hour to make a change? And two, what advice would you give them or just give anyone out there in closing?
So no, you definitely don't have to wait until your darkest hour. I'm a firm believer in having a therapist, having a mental health professional that you talk to, maybe even just once a month, just to touch base with, and to make sure that you're speaking to someone who doesn't really have a dog in the fight. Um, Someone who can offer you tips and tools to manage conflict or difficult emotions. Um, because as you progress through life, you're going to absolutely have tough times. You may need to reach out to someone, speak with them on a regular basis. So I am definitely a proponent of that maintenance, of mental health maintenance. Um, it's kind of like, do you just go to the gym when you've gained 40 pounds? Or do you go regularly and try to get exercise so that you don't get to that point? So it's a mental health maintenance. We have to develop that type of mindset about taking care of our minds the same way we do with taking care of our bodies. Um, so it's an investment. You have to invest in your mental health. And what was the second part of your question? I forgot.
What advice would you give?
Oh, my advice to anyone who's dealing with trauma, any type of trauma, um, is to look for a counselor, therapist, psychologist in your area who um, who's trained in treating the type of issues that you're having. So a therapist who's trained in treating depression, anxiety, PTSD, sexual abuse victims, couples counseling. Um, do not be afraid to ask them questions about their qualifications. Don't be afraid to ask them questions about their treatment approaches. Don't be afraid to ask them questions about them working with clients of color and what their experience has been. And do they feel, are their clients happy with their services? Look for referrals, look for reviews. Now in the internet age, everybody's doing Yelp reviews. Just make yourself aware of if the practice that you're dealing with is reputable. And definitely be choosy. You have the right to be choosy. The same way you would be choosy with a realtor. The same way you would be choosy with a personal trainer. Be choosy with the person you're going to receive mental health services from.
Mhm. Choosy. I like that. I do. I do.
Absolutely.
Well, look, I appreciate you
Thank you.
sharing and just dropping a couple of tools in the toolkits for us. I'll definitely have to have you back on so we can have some more discussions because I want
Yeah.
to talking about different treatment options that are out there as well as like holistic wellness.
Yeah.
I definitely want to have you back on.
Absolutely. I look forward to it. I enjoy it. So thank you. Thank you for the work that you're doing. It's very important. Mental health awareness, trauma and grief awareness, and letting people know that they're not alone and that there are resources out there. So kudos to you for all the work you're doing in the community.
I appreciate you. Okay, well, is there any last words of encouragement that you would like to say? Any program resources that you want to shout out?
Yeah, I mean, as far as words of encouragement, um, you know, don't be afraid to seek services. It doesn't mean that you're broken. It doesn't mean that you failed. It doesn't mean that, something is wrong with you. Um, be proactive with making sure that your mental health is in tip-top shape. Um, it impacts every level of your life, your performance on your job, your performance as a mother or a father, your attentiveness as a husband or a wife. So look at it as a self-improvement measure, not necessarily as a corrective measure. resources. Definitely a proponent of the VA and all of its services and treating veterans with trauma. Um, Also, a lot of other organizations in the Fayetteville community. Heart-to-heart counseling and wellness services is at the top of the list. There's a wonderful young Black woman who owns that organization and is a licensed clinical psychologist. She's doing great things. So just shout out those two organizations. They're doing wonderful things in the community.
There we go.
All right.
I appreciate you and everyone. This is Kimberly and Greg with Guards Down, telling y'all to stay safe, stay focused, and stay engaged.
Absolutely.